Good afternoon, everybody. Thanks for coming today. Want to get started with a few housekeeping details. As part of layered prevention strategies, we ask that everyone present in the room remain socially distanced, and please consider using a mask while you are in the media room. Our speakers today will be providing an important update. This meeting is occurring live and is also being streamed via a virtual press room and on the Department of Health social media pages. We anticipate there will be time for a few questions at the end of our presentation. We do have a hard stop at 4 p.m. due to other commitments. Once again, thank you for coming, and now I'd like to welcome Dr. Nazar Wiebe, North Dakota State Health Officer. Dr. Wiebe.
Welcome, everyone. Thank you very much for joining us today. We are pleased to welcome you here to discuss the recent FDA approval of the Pfizer-BioNTech COVID-19 vaccine and to provide an update about the COVID-19 pandemic in North Dakota. Today, the U.S. Food and Drug Administration approved the first COVID-19 vaccine for the prevention of COVID-19 disease in individuals 16 years of age and older. The vaccine also continues to be available under emergency use authorization, including for individuals 12 through 15 years of age, and for the administration of a third dose in certain immunocompromised individuals. And just right now, I would like to mention that due to some other commitment, the Governor Burgum was unable to be here with us in person today, but he provided this statement that I'll be reading to you. The health and safety of North Dakota citizens remains our top priority, and safe, effective vaccines are our best tool to preserve hospital capacity and protect against COVID-19, including the highly contagious Delta variant spreading rapidly across our state. Today's announcement that the Pfizer-BioNTech vaccine meets the FDA's high standards for full approval instills further confidence that the vaccine is safe and effective and helps address vaccine hesitancy related to the emergency use authorization. Individuals who still have questions or concerns about the vaccines are encouraged to visit with their doctor or medical provider. We thank Governor Burgum and Team ND members for their work on behalf of North Dakota citizens throughout this pandemic response. So, again, more than 50% of North Dakotans have already taken the important step of choosing to get vaccinated against COVID-19 virus. Vaccination continues to be the strongest defense against serious illness. For those who have been waiting for FDA approval, we encourage you to make an appointment to protect yourself and those whom you love. The North Dakota Department of Health has many resources available for citizens on our website at health.nd.gov. The Department of Health and local public health have clinics available weekly. One of these resources is a vaccine locator tool. This tool will help you find a vaccine clinic near you. We also have team members who can help you schedule an appointment if you call the Department of Health hotline. Today, you will hear data about COVID-19, including the Delta variant, which is present and spreading in North Dakota communities. Preventative measures such as testing, isolating, masking, and social distancing have worked to slow the spread of the virus. Individuals should continue to practice these measures. While these practices continue to be important, vaccines are the best defense against COVID-19. By getting vaccinated, individuals are protecting not only themselves, but their communities. They are also playing a critical role in stopping COVID-19 spread and the virus from mutating to other stronger, more dangerous variants. At this time, I would like to invite Kirby Kruger, Section Chief for Disease Control and Prevention at the North Dakota Department of Health, to speak about current rates of infection and trends in North Dakota.
Thank you, Dr. Wiebe. This is an important moment in our efforts to protect against COVID-19. COVID-19, particularly the Delta variant, with its increased infectiousness, coupled with the large percentage of people not vaccinated, may lead to more cases of COVID-19, increased hospitalizations, and potentially more deaths. We know vaccine is a successful tool, and we encourage North Dakotans to choose to be informed about the risk of their communities and to choose to be vaccinated and to take other precautions. I want to provide just a little bit of an overview of disease trends in North Dakota, and we're going to talk about a variety of different things today. But just first of all, starting out, we are seeing increasing cases of COVID-19 in North Dakota, and more than half of those cases are in people under the age of 50. Today, we reported out 105 new cases. 63 of them, or 60%, were under the age of 50. Cases continue to rise. Since August 1st, the number of cases, active cases, has increased from 448 to 1,508, a 237% increase. The 14-day rolling average of test positivity has increased from 3.1% on August 1st to 5.7% today, up 84%. And hospitalizations increased from 25 to 66 in this time period, a 164% increase. The Delta variant has emerged as the predominant variant in North Dakota. During the last reporting period, 149 cases of Delta were confirmed. The Delta variant was the only variant of concern reported in our state during this reporting period. The Delta variant is as contagious as chickenpox. People who have the Delta variant go on to infect, on average, 6 to 7 other people. As of July 31st, in the United States, there were over 4,400 children with MIS-C, the multi-inflammatory syndrome that's diagnosed in children. Children remain vulnerable, and in the United States, anywhere from under 0.5% to nearly 2% of children end up being hospitalized with their COVID-19 infections. They are a vulnerable population, and with no opportunity for vaccination in younger children and with lower rates in older children, we have a potential for a high infection rate this fall as children gather for school. Many children will be hospitalized, and potentially on top of COVID, we have RSV circulating, and later in the fall, we may see influenza. So we have a potential to see a large number of children being hospitalized in North Dakota. And on top of that, we know that young adults are not immune to the consequences of COVID-19. They face the risk of having long-term COVID-19 symptoms that may include fatigue, memory problems, impaired concentration, and trouble breathing, along with other types of long-term effects. There's been lots of questions about reinfection, and on June 27th, 2021, the Council of State and Territorial Epidemiologists approved a case definition for COVID reinfections. Looking at North Dakota's historical data between March 2020 and June 26th of 2021, those individuals that would have met the case definition numbered 947. Since June 27th, with the new case definition, there's been an additional 101 reinfections that have been reported, and only reinfections since June 27th of this year are included in the overall case counts to align with the Council of State and Territorial Epidemiologists case definition. COVID-19 is a serious illness that causes death, hospitalizations, and long-term symptoms. More than 1 in 200 North Dakotans have been hospitalized due to COVID-19. Hospitalizations are increasing. Most cases of hospitalizations and deaths have been in unvaccinated individuals, and only 1,247 breakthrough cases. Someone who has been fully vaccinated for at least 2 weeks and has been diagnosed with COVID, out of over 314,000 fully vaccinated individuals have been reported. So only 1,247 breakthrough cases out of 314,000 fully vaccinated individuals. There's been 107 hospitalizations total in the last 7 days. 28 of those have been under the age of 50. Only 15 were fully vaccinated, or only 17 were fully vaccinated, excuse me. Breakthrough cases in North Dakota since December 14th, there have been 1,247, which is 0.397% of the fully vaccinated, or 0.4% of the fully vaccinated individuals. There's been 94 hospitalizations, which is 0.03% of those people who are fully vaccinated. There's been 18 deaths, which has been 0.006% of those who are fully vaccinated. So out of more than 314,000 fully vaccinated individuals, 1 in 253 vaccinated people have gotten COVID-19 versus 1 in 17 who are unvaccinated. On Thursday of this week, the Department of Health has a town hall scheduled as part of its regular series. The data I shared about reinfection rates and breakthroughs will be discussed further, and the department will be sharing a new tab on the dashboard that will provide more information on a regular basis. I just want to conclude just talking a little bit about the variants. Our surveillance for variants continues in North Dakota. There are 4 variants of concern that have been identified by the CDC. They are the Alpha, the Beta, the Delta, and the Gamma variants. These are cumulative numbers to date. There have been 1,150 of the Alpha variant, 4 of the Beta variant, 373 of the Delta variant, and 42 of the Gamma variant. I'd like to turn this over to Tim Wiedrich now, Section Chief for the Health Resources and Response Section. Tim will be providing an update related to the state medical supply and hospital capacity. Tim?
Thanks, Kirby. The North Dakota Department of Health Resources and Response team is ready and prepared to assist the state with this COVID situation. We have had a number of activities that are going on with hospitals. That includes participation in their planning activities, monitoring the capacities within the hospital system, and providing support where there's need. As of this morning's report, we had 66 hospitalizations, people in the hospital with COVID. 12 of those were in the ICU. I do want to report some numbers regarding hospital staffed bed capacity. These are the numbers of available beds within North Dakota currently that are staffed and available to receive patients. So if I look across the entire state, including all hospitals, again, these are staffed beds. There are 28 ICU beds as of today and 242 general acute care beds. 6 pediatric general beds. So that brings us to a total of 276 beds within the state that are available. Now, those numbers are a snapshot in time. And so if you come to me 3 hours later, those numbers will have shifted because the hospitals continuously receive and discharge patients. Looking more specifically at the 6 tertiary care centers, these are the large hospitals in the 4 major cities, those numbers have a total of 43 beds that are available within those 6 hospitals. And they break down into 14 ICU beds, no PICU beds, 23 general acute beds, and 6 pediatric beds. Again, that's a total of 43. In terms of the facilities availability of supplies and equipment, obviously the facilities have been acquiring both disposable supplies and medical equipment on their own and continue to do that. But there's also a state medical cache, which is a partnership that's within the state amongst all of the medical facilities, including hospitals, long-term care, and others. And the cache is in good, solid shape. We have had, for example, PPE, N95 respirators, which are the type of respirators that medical personnel will typically wear. And at the beginning of COVID, before we had any actual COVID, we had 1.4 million of those N95 respirators. We depleted most of those during the response that's been going on so far, but now we have restored those levels to about 3.2 million N95 respirators. So just as an example of many other pieces of equipment and supplies that we've been successful in preparing from the available supplies to make sure that we are in a strong position to respond. Well, that's the information that I have prepared for you today. Up next, we have Molly Howell, who is the North Dakota Department of Health Immunization Program Director. Molly?
Thank you, Tim. And good afternoon, everyone. So I hope we all know how important vaccines are in general. All vaccines are important. It's back to school season right now, so please make sure your kids are vaccinated before going back to school and make a plan for flu vaccine for this upcoming fall. But COVID vaccination is critically important. Those who are eligible, which is everyone 12 and older who does not have a contraindication, meaning a severe allergy to COVID vaccination, is recommended to be vaccinated. And it's especially important for pregnant women, those who are immunocompromised, and the elderly, and everyone around them to be vaccinated. Today, as Dr. Wiebe mentioned, the FDA has fully approved Pfizer's COVID-19 vaccine for people 16 and older. I'm going to try and say the brand name. I'm still not used to it yet, but it's Comirnaty, was approved based on strong safety and effectiveness data. And its vaccine also continues to be under emergency use authorization for people 12 to 15 years of age. Over 360 million doses of COVID-19 vaccine have been given in the United States to date. 686,630 doses have been given in North Dakota alone. So I hope North Dakotans who are not yet vaccinated now feel confident in the safety and effectiveness of COVID-19 vaccines and choose to be vaccinated. Rates are still not as high as we would like. 56.7% of North Dakotans ages 12 and older have started the COVID vaccine series or have at least one dose of COVID-19 vaccine. Vaccination continues to be safer than risking severe outcomes from COVID-19 illness. Now is the time to get vaccinated before Delta is here. We have the benefit of learning from our friends down south, and now is the opportunity to get vaccinated. Also, since we were last together on August 13th, the Advisory Committee on Immunization Practices, also known as ACIP, recommended that all immunocompromised individuals receive an additional dose of an mRNA vaccine, which is the Pfizer or Moderna vaccine, if it has been 28 days or more since their last dose. This additional dose is necessary because immunocompromised individuals did not receive the full benefit of vaccination initially with their 2-dose series. People included in this group are severely to moderately to severely immunocompromised. So we're talking about people who have had organ transplants, uncontrolled HIV, who are on chemotherapy, or maybe on immunosuppressive drugs. And anyone out there who's wondering if they're considered immunocompromised should give their healthcare provider a call and receive guidance on whether or not to receive an additional dose of COVID-19 vaccine. Even with this additional dose, immunocompromised individuals, because of their immune systems, might not get an adequate boost in their immunity, which is why it's important that they still socially distance and wear a mask. And it's important for those around them to be vaccinated to make sure you're not passing COVID-19 to someone who's immunocompromised. There was also quite a bit of media late last week regarding booster doses. Booster doses are different than additional doses. So additional doses are for people who didn't receive an adequate immune response initially to vaccine. Booster doses are for people who did initially have a good immune response, but that their immunity is waning since they were initially vaccinated. Next week, the Advisory Committee on Immunization Practices is meeting and will likely discuss booster doses, and we should have more information after that meeting. Currently, booster doses are not recommended for anyone in the United States. It is likely, though, that in the future, certain individuals will be recommended to receive a booster dose. This happens for a number of vaccines that we use in the United States. And the Department of Health and our partners are currently planning to administer booster doses. So with schools starting, only 29% of adolescents 12 to 17 have received at least 1 dose of COVID vaccine. So we are concerned about the upcoming school year and low vaccination rates. And so we encourage all children to be vaccinated as soon as possible. Additionally, now the CDC, ACOG, which is the American College of Obstetrics and Gynecology, and the Society for Maternal Fetal Medicine all recommend vaccination of pregnant women to protect not only the woman, but her fetus. Additionally, these groups recommend vaccination of those planning to become pregnant and those who are breastfeeding. Pregnant women are at greater risk for severe outcomes due to COVID than non-pregnant women. And there's been a number of safety systems now that have looked at the safety of COVID vaccine in pregnant women and have not seen any concerning safety signals. And the rates of miscarriage are similar between those vaccinated and those not vaccinated. The United States is seeing an increase in hospitalizations amongst pregnant women, and so pregnant women are encouraged to talk to their doctor about vaccination. Bottom line is we have adequate supplies of COVID-19 vaccine in North Dakota and in the United States, and more than 420 facilities in North Dakota are currently vaccinating. We are hosting a number of pop-up clinics at various convenient locations, and anyone who's interested in getting vaccinated should have a conversation with their healthcare provider if they have any questions or any concerns about the vaccine. And anyone who's struggling to find vaccine, whether you're homebound or you don't have internet, should call our hotline at 866-207-2880 for assistance. I will now turn it over to Paul, who's going to facilitate a little bit of Q&A.
Thank you, Molly. Just a very quick housekeeping note on this. For any reporters who are joining us in our virtual press room right now, you can ask questions in the Q&A tab, which is near the top of the window, and it looks like 2 text bubbles conversing with each other. Submit your questions, and then we will submit them to our subject matter experts. Again, we have Dr. Wiebe, Molly Howell, Kirby Kruger, and Tim Wiedrich here to answer any questions. Jeremy.
I think this could probably be for Dr. Wiebe. What specifically is the health department doing right now to address this obviously fluid but worsening situation? What are some of the things that you're looking to implement?
Yeah, so there are many activities that are ongoing in preparation for these worsening numbers. So we are monitoring the number of cases that are happening. We are very active in the testing aspect to ensure that those who might have symptoms or have were in close contact that could be tested. We've been meeting with the big 6 hospitals in the state in order to ensure that there is a coordinated and communicated response and that we are always on the same page, especially when it comes to number of hospitalized or hospital beds as well as ICU beds. Of course, vaccination is still the strongest way to prevent and stop the infection of COVID-19. So we are still very active on the vaccination front. We've been till today, we've been doing a lot of pop-up clinics that will allow anyone to schedule or even to walk into these clinics and get vaccinated. And these will be ramping up in a more coordinated way as we start talking about a 3rd dose as well as booster shots. So these are a few of the aspects that we are trying to stay ahead of the curve and make sure that we are ready and prepared for any worsening cases.
Gotcha. And then one follow-up, I guess. We've been talking about masking for 1.5 years now, of course, but how important is that aspect of virus prevention right now at this point? Because, as things look, and you probably live in the area, there's very little mask wearing in public.
Sure. So let's kind of like have kind of like the clarity that there are many aspects of prevention and ways to stop or reduce the spread of the virus, whether it is hand washing, social distancing, masking, the availability of testing, contact tracing. All these are different measures that will allow us to control the spread of the virus and make sure that it is not spreading beyond what it should. Of course, the biggest one of these preventative measures is, again, vaccinations. So we are here and available to provide all the information to allow everyone to make their decision of how to have a combination of all these preventative measures in order to stop the spread of the virus, as well as to protect themselves and their loved ones. Mm-hmm. Yes, please.
There was some mention of the breakthrough cases, and with those breakthrough cases that we're seeing among vaccinated people, how do we know who should be getting tested for COVID?
We'll let Kirby answer this question.
So, good afternoon, and that's a good question. The question is amongst individuals who are vaccinated, how do you know when they should be, if they should get tested for COVID-19 or not? And I think the general recommendation for those who are unvaccinated still remains the same. If they are symptomatic or if they've been named as a close contact, testing is a good idea. For those who are vaccinated, what we recommend is that if they're named as a close contact, they should consider being tested 3 to 5 days into that period where they would have been quarantined. They don't necessarily have to quarantine if they're asymptomatic. Or if they develop symptoms, they should be getting tested. So, Jeremy?
I could ask you. So, throughout the pandemic, we've heard that the number of positives that are reported is just bound to be understated because testing is not a perfect game, I guess. But are the numbers now any less or more valuable to people like you in determining, how far this vaccine is spreading?
The question is regarding our surveillance numbers, and I think public health surveillance is always a challenge because there is a lot of fluidity in how numbers get reported to us, and it is subject to what's happening in the communities. The more testing that's going on, the better, the more confidence we can put into some of the numbers that we have, although it's not perfect. So from our perspective, I want to put this into perspective where we're really at, because I looked at the data this morning. About a year ago, we had about the same number of active cases that we have right now. The number of cases is actually about the same, but our testing is just a fraction of what we were testing last year. So we are finding more cases per test this fall than we were, or this late summer than we were last year. And so we have to take all of that into consideration. So we look at positivity, we look at cases reported, the numbers, we look at case rates, we look at hospitalizations. I think we have to look at a variety of data sources to try to piece the picture together. But I think it's clear to us that when you look at trends and you look what's happening in North Dakota, you know, these increases are real, and they're probably even underestimated, you know, from our surveillance. So.
From Jacob Derman, KFYR. Jacob says, over the past week, the proportion of active cases with being breakthroughs has jumped from 7% to 15%. Is there worry that the confidence of this approval will be offset by the increasing share of breakthrough cases?
So we are, in North Dakota, we are tracking all breakthrough infections, regardless if they're just cases or if they're hospitalized or if they die due to COVID-19. And so we are closely monitoring it. I think with increases in cases overall and increases in Delta, we're going to see increases in breakthroughs, the same thing. And so these vaccines are not 100% effective. Last week, there was a lot of information put out regarding why we would need boosters in the future. And part of the reason is because whether it's due to waning immunity or it's due to the Delta variant, but these vaccines do have reduced effectiveness. There were 3 studies that were put out last week showing that reduced effectiveness, and I can pull them up here. But overall, vaccine effectiveness against hospitalization and death and severe illness is still extremely high for these vaccines, which is what we really want. We want to be able to have hospital capacity and not have people have severe COVID-19 illness. And so we kind of have to put it into perspective. But I think as we see more cases in the state, then yes, we're likely going to see more breakthrough infections as well. Yeah. Oh, go ahead.
I can ask you another one. You know, in talking with you previously, you know, you mentioned that this maybe was one of the shoes to drop the full approval of one of the vaccines. How confident are you that this will increase the willingness of some people to get the vaccine here?
I think there are some people that were waiting for full FDA approval in order to be vaccinated. National surveys are estimating it at even as 30% of those who are not yet vaccinated were waiting for full FDA approval. I don't necessarily know what percent or what that's going to translate to in North Dakota. I'm hoping, even regardless of the full FDA approval, just the sheer fact that over 360 million doses have been administered in the United States, that's huge. That's way more than we give a flu vaccine in a single season. That's more doses than vaccines that have been fully FDA approved for years that we've given in the United States. Our hospitals are not full of fully vaccinated individuals due to the vaccine or because of COVID-19. And so people should feel confident in these vaccines because of that. But yes, I'm hopeful that some people will see the FDA approval and that will give them more confidence that an agency that we've trusted for years to look at our biologics vaccines went through a thorough review of the data and determined these vaccines to be safe and effective.
Hand in hand with that, for those unfamiliar with the distinction, can you explain the difference between emergency use authorization and full approval, how we get from one to the other?
Yeah, sure. The Pfizer COVID vaccine was authorized by the Food and Drug Administration last December and was not fully approved. In the United States, to fully approve a vaccine requires a high amount of data, inspections of manufacturing plants, and a prolonged period of time to review the data by the FDA. And so in order to get emergency use authorization, because we are in a pandemic and it is the middle of an emergency, the FDA required a certain criteria in order to get that authorization. They required the vaccine to be effective, they required a certain amount of safety information, and they required a certain amount of participants in the clinical trials in order to get that emergency use authorization. And so now with FDA approval, we have 6 months post-vaccination safety data. We have, I believe it was over 20,000 people in both the vaccinated and control groups looking at the effectiveness of the vaccine, which was 91% in the FDA clinical trial. And then the safety was in over 22,000 vaccine recipients and 22,000 placebo recipients in order to get full FDA approval. Any other questions?
That's going to wrap up our event today. Thank you very much for your time this afternoon, and stay healthy, North Dakota.